Hello, this is Dr. Marty Klein. Today I'd like to talk about desire. Desire for what? As a sex therapist and couples counselor, I work with a wide range of issues every week. But year after year, there's one issue that's extremely common. I'm always working with couples in conflict about each other's sexual desire. Periodically, for example, I see a couple in which one partner is angry at the other for not wanting sex enough. Somehow, that person expects that expressing their anger will motivate their mate to want sex more. Then they're surprised when their anger results in less sex rather than more. Some of the lower desire partners are on the fence, possibly open to more sex under the right circumstances, but their partner's periodic anger simply never allows those circumstances to emerge. In other cases, the lower desire partner uses the higher desire partner's anger as the perfect excuse. See, what do you expect? Who could have sex with a person who's always criticizing? You might be surprised at the number of people who ignore their partner's emotional needs for days or weeks or pretty much all the time, and then approach that person for sex, who of course typically declines. Many of these decliners seem to me like they really do want sex and are regretful or frustrated when they say no. Their partner frequently thinks, "You're just not sexy," or "You just have low libido." The person who's chasing is surprised when I go out on a limb and say, "Actually, I think your partner really wants sex, but needs more non-sexual attention or emotional connection in order to accept your sexual invitations." They're really surprised when their partner says, "Yes, that's right." Why is this still such big news? Now, it's true that some people, more or less independent of circumstances, are horny and want frequent sex. Other people need to feel connected first. Neither version of sexuality is better than the other, but when you put one of each type together, you have a truly mixed marriage. Each one tries to convince the other that their way is better, and no one ever succeeds at doing so. In my clinical experience, people who want affection or connection before desiring sex are not going to change that. Anyone who's waiting around for a partner to change this is going to be frustrated. On the other hand, people who don't need such a connection can learn to enjoy creating that with someone, and they get more sex as a bonus. When these cases resolve successfully, not a huge proportion, I admit, that's often how it happens. Desire also raises the question of the quality of the sex that people think is available. Although Lenny Bruce famously said that most men are so generically horny that they'll have sex with mud if necessary, most men and women want more than that from sex. Even if someone doesn't crave emotional connection as part of sex, most people who want sex want something more than simple passivity in a partner, or a partner who won't look at or kiss them. Many lower desire people complain that when they do agree to sex, their partner charges ahead full speed. These lower desire people often say they feel their partner is having sex with their body, but not with them. "If he were actually connected with me during sex," a patient once said to me, "he wouldn't go so fast or get that far ahead of me." So, desire for what? When I talk about desire in my 2012 book, Sexual Intelligence, I ask desire for what? And again, some people desire just sex, and if there's no deal breaker present, lack of privacy or a current quarrel or somebody has a cold, they're in the mood easily and quickly, regardless of the kind of experience that they expect. On the other hand, many people say that if the sex that is available is with someone who doesn't bathe very much or kisses too roughly or is impatient and easily annoyed, that their desire is low. While some, including their partners, call such people low desire, I don't, unless, of course, they anticipate that every sexual experience will be unpleasant and therefore unwanted, regardless of circumstances. Some people have inhibited desire because they're anxious about performing. They may believe that if they can't deliver lubrication or erection on demand, their partner will be upset and they'll be embarrassed. In fact, many people of all genders and all orientations are concerned that if they don't have an orgasm, their partner will interpret this as a criticism or a reflection that they lack attraction. Some women go further, feeling insulted if their male partner can't climax inside their vagina every time. These desire cases may be slightly easier to resolve because frequently there's desire there. It's just being constricted by anxiety. Of course, not all anxiety can resolve that easily. Some people require medication. This is often successful, but ironically, medication can inhibit libido or arousal, and so there may be no net gain. And some people are anxious as a response to trauma, which can be very difficult to resolve. So, dividing people into two simple categories, high desire and low desire, is way too simplistic. Therapists and physicians do this a lot and shouldn't. In fact, most people do it, describing themselves or their partner as low desire or high desire. When I have to use a description, I say higher and lower desire, emphasizing the comparison. I'm not entirely comfortable even with that, and I always follow it with lots of explanation, as I've done here. When contrasting a pair of sexual partners, we should be categorizing other dimensions as well, such as higher connection, lower connection, or higher gentleness, lower gentleness. Of course, that would acknowledge that things are more complicated than we wish they were. Now, a word about people who need frequent sex. Sorry, nobody needs frequent sex. People want frequent sex, and I have no quarrel with that. But when people tell themselves the story that they need frequent sex and just can't help being a poor parent or a poor partner or a poor employee when they don't get enough, that's problematic. Besides, few people want to be the remedy for this kind of their partner's sexual need, essentially being the medicine that their partner requires in order to behave like a responsible grown-up. So what might lie behind the story that someone believes they need frequent sex? It could be they want continuing reassurance that they're desired or loved. It could be that they get anxious when they feel separate and sex makes them feel connected, reducing their anxiety. It could be they fear their partner's abandonment and like the reassurance of frequent sex. People express a wide range of unconscious emotional needs using a sexual vocabulary. Helping people work through why frequent sex is so important often reduces the urgency of their drive. That can lead to their partner being more interested in sex, thus connecting the two partners in ways that weren't available before. Contrasting sexual desire between two partners is famously difficult for therapists to resolve, particularly if we don't believe in the just close your eyes and do your marital duty model. But with careful evaluation, we can identify the cases that are more likely to respond to treatment and choose treatment strategies that can help. It's crucial for professionals to see beyond the simplistic idea of simply increasing the low desire partner's libido. Couples need that broader perspective too. I'm Dr. Marty Klein. Thanks for joining me. I publish one of these video quickies every couple of weeks, so if you'd like to get a note when I do, just click the subscribe button below and you'll get a little note when I publish one. Thanks for joining me.